Hi friends, this is Dr. Abdequaem Chinthanawala. Today I'll discuss a very important and a very frequently used remedy, of which symptoms I have found very useful in my practice. I'll discuss that in the clinical part which I have seen. The remedy is Sabadilla. And whenever Sabadilla comes to our mind, the first thing that comes to our mind is the nose symptom, the coryza symptoms of Sabadilla. Remember, I have seen in Sabadilla the most important symptom that I have seen in my practice is coryza from change of temperature. Whenever the temperature changes, for example, it is raining in the morning and suddenly in the evening there's no rain and bright light in the afternoon, 2 o'clock, 3 o'clock, and the patient starts getting sneezing and coryza. In that case, I have seen Sabadilla gives us very good results. So coryza with change of temperature. And of course, when the patient comes to you and tells you, Dr. Saab, I have this Sardika problem, this nose problem, this coryza problem since years and years. I take treatment, it is better, I stop it, it comes back again. This is again a very important symptom where the patient says coryza long, it is so chronic and long continued, he doesn't get relief with any medicine, and that is the indication of Sabadilla. You'll also see cases where the patient comes and says, Dr. Saab, I have fever, no? And the fever started with my nose symptom, that is coryza. So जब भी पेशेंट बोलता है मेरे को सर्दी हुई है और बुखार आ गया है, whenever I get coryza, I have fever, think about Sabadilla. Don't always go with allium cepa or arsenic album or justitia or aurum triphyllum. This is a very important symptom of Sabadilla, that is fever with coryza. And of course, the important symptom of Sabadilla modality is so important that the coryza is generally better or ameliorated in warm room. Whenever the patient says that I switch off the fan, I switch off the AC, I close the doors and the room becomes warm, I feel better, then you have to think about one of the remedies, important remedy in this symptom is Sabadilla. Or the patient comes and tells you that whenever, sir, I get up and wake up in the morning, I get sneezing, I get coryza. That is also again a very important symptom of Sabadilla. You know, sometimes a patient comes to you and says, Doctor Sir, I have a lot of watering from the nose, but there is no sneezing, there is no coryza, only watering from the nose, I just keep wiping my nose. This is again, a patient is telling you a very important symptom of Sabadilla, that is coryza, or you can say discharge from the nose without coryza. Remember this symptom, discharge from the nose without coryza, because of late you will get a lot of symptoms of this type of cases, and you may sometimes be tempted to either prescribe arsenic or justitia or aurum triphyllum or other remedies, but Sabadilla, don't forget this symptom, that is discharge from the nose without coryza. And in some patients, the discharge is very hot discharge, that is also Sabadilla. Then you come to the blockage of nose. You know, of course, there are so many symptoms of Sabadilla nose, but I'll just tell you the symptoms which I have seen and verified in my clinical practice. The patient comes and tells you, sometimes when this nostril is blocked, sometimes this is blocked, sometimes this is blocked, sometimes this is blocked. So nose is blocked alternately. So don't interpret this symptom as changeability and first prescribe pulsatile. Don't do that. This is a very important symptom of Sabadilla, that the nose is stopped up alternately. And again, an important symptom of Sabadilla is sometimes a patient tells you, okay, Doctor Saab, if I get one sneezing, no, मुझे एक छींक अगर आ गई ना तो मुझे सर्दी में नाक खुल जाए और अच्छा लगेगा मुझे. So he tries to get sneezing forcibly, and that is again an important indication of Sabadilla, that is sneezing forcible. And to end what I have seen in my clinical practice, the patient comes and tells you, whenever I go in the gardens, everybody enjoys, but I get sneezing. Beautiful people give me bouquets of flowers, but I start getting sneezing. This you all know, that sneezing from odors of flower or sneezing from odors also. The patient goes and the odor is bad, good, whatever. It is a strong odor and that creates sneezing. That is again Sabadilla. So these are the symptoms which I have seen in my clinical practice since the past 25 years. That's what I'm sharing with you. There are other symptoms, lot of symptoms in a materia medica and repertory, but I have just shared my clinical experience which I have seen in cases of Sabadilla. So my dear friends, if you like this video, do share and subscribe. Thank you.